Signs and symptoms of cancer that must not be ignored. The tricky thing about cancer diagnosis at its early developmental stages is that either they don't present any symptoms at all, or if they do, they are symptoms that can be linked to a variety of different causes and diseases. We are fortunate to live in an era where better cancer screenings have increased the likelihood of recovery following a diagnosis. Routine tests can help discover illnesses early when they're simpler to treat. Therefore, it's critical to see a primary care physician on an annual basis who is familiar with your medical history and can advise you whether or not to be concerned about the changes in your body. How does cancer cause signs and symptoms? When cancer cells grow into or begin to push on nearby organs, blood vessels, and nerves, the pressure will cause some of the signs and symptoms of cancer. Weight loss, extreme fatigue, fever, etc. are some of the symptoms caused by cancer. This may be due to the cancer cells using much of the body's energy supply. Cancer could also release substances that change the way the body makes energy. It could also cause the immune system to react in ways that produce these signs and symptoms. The signs and symptoms we are going to discuss may not necessarily mean that you have cancer, but it is better to be safe than sorry. Early detection saves life. Number 1. Skin changes. The skin is the largest organ of our body. Not only does it shield us from outer threats, it also reflects the inner anomalies that our body is going through. Pay attention to what your skin shows you. If there are unusual or new moles, bumps, or marks on your body, consult your doctor to be sure that skin cancer, melanoma, isn't lurking. Bleeding sores that won't go away are also symptoms of skin cancer. Your skin can also provide clues to other kinds of cancers. If your skin is persistently darker than normal, appears yellow or red, itches, or grows unusually more hair, or if you have an unexplained rash, it might be a sign of liver, ovarian, or kidney cancer or lymphoma. Enjoy the video, then give it a like and share it with your friends. This will help the channel. Number 2. Sores in the mouth. A long-lasting sore in the mouth that does not heal could be a symptom of oral cancer. If you smoke, chew tobacco, or drink a lot of alcohol, you're at higher risk. Number 3. White spots in the mouth. If you notice thickened white patches on the mucous membranes, lining, of the mouth, gum or tongue, it could be a sign of leukoplakia. It is often caused by smoking or other types of tobacco use, such as chewing tobacco. Long-term alcohol use and other chronic irritants also may contribute to leukoplakia. Leukoplakia can have various appearances in the mouth. It may appear as white or grayish patches that can't be wiped away, irregular or flat-textured areas, thickened or hardened areas, raised, red lesions, erythroplakia, which are more likely to show precancerous changes. Leukoplakia can go away without intervention if it is mild. However, it should not be taken lightly as leukoplakia is considered a precancerous condition. In some cases, it has been found that leukoplakia is an early sign of mouth cancer. According to the Cleveland Clinic Health Library, it can eventually develop into oral cancer. Within 15 years, about 3 to 17.5% of people with leukoplakia will develop squamous cell carcinoma, a common type of skin cancer. Number 4. Yellowing of eyes and fingertips can be a sign of possible infection or tumor in liver, gallbladder, or pancreas. Number 5. Lumps in breast, testicles, neck, armpit, abdomen. Breast cancer can occur in both men and women, but it's far more common in women. According to Mayo Clinic, the signs and symptoms of breast cancer may include a breast lump or thickening that feels different from the surrounding tissue, change in the size, shape, or appearance of a breast, changes to the skin over the breast, such as dimpling, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of skin surrounding the nipple, areola, or breast skin, redness or pitting of the skin over your breast, like the skin of an orange. It is good to perform self-examinations and feel the breast tissue regularly. In this way, you will be able to distinguish when there is a change in the tissue. Lump formation in the neck, breasts, underarms, or groin which persist for weeks can be an indication of underlying malignant tumors. Self-examination of these soft tissues should help you discover changes before they potentially develop into larger tumors. Number 6. Unexplained weight loss. A rapid loss of weight and loss of appetite for no apparent cause might be a sign of cancer. Almost 50% of cancer patients lose weight. It's usually one of the first indications they notice. This often occurs with people who are diagnosed with pancreas, stomach, esophagus, and lung cancer. Hence, people who experience a rapid loss of weight should consult the doctor to get to the bottom of what could be causing the sudden weight loss. Number 7. Fatigue. Do you feel tired constantly and resting doesn't help? Excessive tiredness that does not improve with rest might be a symptom of cancer. This could be a symptom of leukemia, colon cancer, and stomach cancer. Leukemia can exhaust you, while colon or stomach cancer might cause blood loss as well, resulting in you feeling tired. Number 8. Persistent pain. Any persistent pain that has no obvious explanation and does not respond to conventional therapies can be a sign of tumor and should be examined. Pain can be caused by the cancer itself. If the cancer grows into or destroys nearby tissue, you will suffer pain. As a tumor grows, it can press on nerves, bones, or organs. The tumor can also release chemicals that can cause pain. Bone cancer is typically painful from the start. Some brain tumors induce persistent headaches as well that do not improve with therapy. Pancreatic, brain tumors, and sarcomas are the most painful cancer types. The amount of pain depends on the type of cancer, where it is, the stage of the cancer. In some cases, cancer that's spread or metastasized can cause pain. For example, back pain may be present in cancers of the colon, prostate, ovaries, rectum. Number 9. Fever. People who have cancer will often have a fever as a symptom, as fever is the body's response to an infection or illness. It is usually a sign that the cancer has spread or that it's in an advanced stage. Fever is rarely an early symptom of cancer, but a person who has a blood cancer, such as leukemia or lymphoma, may experience fever at an early stage of the cancer. Number 10. Unusual bleeding. Unusual bleeding is never a good sign. Cancer can cause blood to appear in places that it normally should not. For instance, bloody stools may indicate colon or rectal cancer, while blood in the urine may be a symptom of prostate or bladder cancer. Some cancer may cause internal bleeding, which is harder to detect. Stomach cancer may result in internal bleeding. It is important to seek treatment when such bleeding is observed. Number 11. Anemia. Anemia is a deficit of red blood cells or their oxygen transporting capacity. Anemia can make you feel weary and weak, and you may feel exhausted and fatigued all of the time. Anemia may be one of the first signs of cancer, especially for persons suffering from colon cancer or blood-related cancer such as leukemia or lymphoma. Number 12. Bloating and persistent stomach discomfort. Bloating refers to a condition in which your stomach feels full and tight, usually as a result of gas. Bloating can result in pain, discomfort, and a sense of stuffiness. It can also give an impression of a larger stomach. If the bloating lasts for more than 2 weeks in a month, it is a cause of concern. Stomach bloating is a main symptom of ovarian cancer, or cancer of the ovaries, one of the most common types of cancer in women, according to the NHS. If bloating is persistent and does not vary with changing eating habits or bowel movements, it is a good idea to seek medical care, according to Alex Hewlett, Associate Professor of Medicine at the University of Nebraska Medical Center. Number 13. Chronic coughing and difficulty in swallowing. A cough that lasts longer than 2 weeks, particularly if it is dry cough, is a classic symptom of lung cancer. Hoarseness or dysphonia, which refers to a strained, raspy voice, can indicate the presence of cancer in the larynx or thyroid gland. If you have difficulty with swallowing for more than 2 weeks and feel like food is getting stuck in your throat, it might be a symptom of throat, lung, or stomach cancer. Enjoy the video. Do share if you know of anyone who has any of the symptoms of cancer in the comments section below. We love to hear from you. And if you liked this video, then make sure to click the like button and subscribe to the channel so that we can keep coming up with your favorite content.